Thank you. Good
Thank you.
morning, Dr. Lee.
Thank you so much for here. This is truly my honor as acupuncturist, and then seeing so many patients suffering with this food sensitivity. You created something so valuable. I always said a gift. You gave this gift to us. So I'm so anxious to share, learn about your approach. Dr. Devi Nambudripad. Hi, Doc.
Hi. Good to be here with you. I'm so excited to share my little knowledge to add to your practice and to help your patients. I'm honored to be here, actually.
You're so humble. So anybody, Dr. Nambudripad, she has so many credentialing after her name. She's a chiropractor, acupuncturist, and MD, and then there's just so many. So you can tell how much like a study she's been devoted her life in this for profession. So I'm as an acupuncturist and a fertility expert, and I want to share about, I want to learn about actually what she's doing and then helping all our patients. So can you talk, can you share about what is actually NAET?
Yes, I would be happy to do that. And if I want to say NAET in one line, that will be easy to do it, but you don't understand a thing. So if I want to do the right thing about explanation of NAET, I really need to take a couple of minutes and explain what is NAET all about and how did I discover this and how did this come by. So you will have to hang in there for a couple of minutes. Okay. NAET is the short form for Nambudripad's allergy elimination technique. Nambudripad is my name. So I named this technique after my name. I didn't know how else I should name it. Okay, what is this NAET does? This one I created in 1983, 40 years ago, probably before most of you were born. And I made this, or I developed this, taking a little bit of information from all these different classes I attended and put it together to remove or to eliminate or reduce my own food sensitivities and allergies and my family's. Okay, so that's what I'm just going to talk a little bit about it, how this came by. I suffered from food sensitivities since birth, I can say, since childhood. Okay, I was born with a lot of skin rashes and eczema. That's what my mother had told me. And then I continued to have all these different kind of health disorders all the way through my childhood. Then later on, I got married. Within 2 years' time, I had 4 miscarriages, one after another. Okay. And my doctors thought probably I can never carry to full term and have a normal child. So that made me very sad and depressed. And I did spend some time in depression, a few weeks. Then I thought, why am I wasting my time like this? You know, it's not everything that you need to have a child. You can have a different life. So I wanted to go back to school and become a pediatrician, and so that I can be among children all the time, even if I didn't have one of my own. So I returned to school. Then I told my mother, I shared her my feelings and what I'm planning to do. So she said, don't give up hope. You want to be brave, and but you also need to think of God. I was thinking of God, but she thought I'm not praying enough. So she told me, you need to pray. And along with that, I need to do some strict fasting on Hindu religious holidays. If you want to know what is that, water fasting on Hindu religious holidays, that is the strictest fast we have. 5 days a week. You have to only drink 8 glasses of water a day, 8 glasses of boiled, cooled water a day, and eat few pieces of fruits here and there, just to keep you survive. And no other food will be eaten during those fast days. Then 2 days a week, you can eat anything you want. So the 2 days that we can eat, that is Wednesdays and Sundays. All other days, the fast days. So I said, what is that, Luz? I'll try that. So I followed my mother's advice, and I strictly did the fasting 5 days a week for a long time. And during that time, whenever I did the fasting, the next day I woke up so good. I didn't have any more asthma. I didn't have any more headache. I didn't have any more body aches, and skin started clearing. All fantastic results started happening. I thought, wow, this is great. God is really helping me. But God helped me to overcome my sadness and depression, definitely. I was vibrant. I was not even thinking about children anymore, okay? And then what else was happening? While I was going through this fasting, 5 days a week, I was avoiding all kind of foods, all allergic foods, all sensitive foods, everything I was avoiding strictly. And I was drinking a lot of water. So the water was also helping to detox and flush my toxins that I collected from childhood or through the years, right? Everything was loaded in my body. Everything started coming down. And my meridian started getting flushed out with all these toxins out. And my circulation started getting better. My blood circulation started getting better. My energy circulation started getting better. That's the reason I was feeling always very high and elated and great. So I went through this schooling. Then I was ready to go to medical school by the time I got pregnant again. So this time I said, now what am I going to do? I had to do the school, and now I had to go through the pregnancy. And since I was pregnant, I didn't want to take a chance of losing it again. So I was very careful, stayed home mainly. And then I did not feel sick at all. I did everything good, carried to full term, had a normal childbirth, had a normal healthy boy.
Wow.
So I was so happy. I said, okay, but now I'm already in the medical school, so I don't want to quit. I wanted to continue it. So I continued going through the school all the way. And after a while, after I had the child, now I forgot about the fasting. Okay? I started skipping the fasting here and there because I was feeling so good. So I thought maybe my allergies are gone. So let me start eating normal food. As soon as I started eating normal food, my previous problems started coming back one at a time. All of a sudden, I was back to where I started, back to square one. I said, oh no, this is not good. So I started doing fasting in between, few days here and there, and I'll eat whatever I want. So it went on for a while. Then I graduated from the medical school. Then my ideas changed. I don't want to become a pediatrician anymore. I wanted to find a cure for allergies. You are not supposed to use the word cure in medical terminology, but in my opinion, I wanted to find something to stop the allergies completely so that I can eat anything I want to, and I don't have to be afraid of eating. I don't have to be afraid of avoiding things. So that's the kind of thing I wanted. So what I did, I also started praying. Now, without my mother's prompting, I did my own. Okay, I prayed to God, I want some kind of method or something to help me to completely cure my allergies. And so during the search of for this cure or the for this allergy treatments, I went through all different schools because one school alone cannot give you all information. So I went through allopathic school and acupuncture, chiropractic, homeopathy, and nutritional medicine. I went through all this and got a lot of information from everywhere, little by little from everywhere. And I gathered together, I concocted this treatment that helped me to eliminate all my food sensitivities and allergies completely. And I could eat anything I want to without having to worry about bringing back the reactions or any kind of health disorders like that. So then I named that technique NAET.
Wow. That is such a great story though, because I see the power of fasting. But problem is someone like us, we can't really do like you did. And that's just amazing story. And then the pray and then support from your mom and then God, because that's what we also need in this, whatever the illness people are going through, those are support and confidence. Thank you so much for that hard work for us, Doc. So let's dive into the fertility specific with the food sensitivity. So can you explain why you think that this is food sensitivity problems with any like a relationship with the infertility specific?
Okay, when you eat any kind of nutrients and food and if you're allergic to it, it is going to cause problem anywhere and everywhere in the body. If your organs in the reproductive areas are weak, and that's where the allergies are going to affect. And any food, if you are eating if you are fairly sensitive to many items, you may eat about 3 or 4 items a day, and that the toxins coming from those will focus on a weakest area. If your heart is weak, this is going to affect your heart. If your liver is weak, all the allergies are going to go to the liver. If your reproductive organs are weak, these allergies or sensitivities are going to affect the reproductive organs. Your uterine lining will be messed up. Your ovulation cycle will be messed up. And you are accepting the sperm. It cannot happen properly. So there are so many causes for infertility, not just only food sensitivities, sensitivity in altogether. It can be anything. It can be allergic to a lot of different things. So all this can affect your ability to reproduce or to carry the child to the full term. So like that. So that's the reason the sensitivity is very, very important. We all eat. What do we do every day? All over the world, people all over the world, we eat.
I see.
Right? Without eating, you cannot survive. You can do everything else. You can do without praying, going to church, and everything is okay. But without eating, how can you do that? You have to eat. But if you are eating allergic food, and if you are having some problem in your body, and those problems are going to be affected by this eating wrong food. So it's very important to remove the sensitivities to whatever you are eating. Then you eat, okay? So main cause of infertility is the food sensitivity because we all eat every day, all right? So once when you clear the sensitivity, half of your problem is gone. Then rest of the half only you have to worry about. So probably if somebody is not very allergic to a lot of things, if you remove the sensitivities, automatically you will become pregnant, or your natural function, body functions will start normally, without even focusing on it. Okay, that's what happened to me when I did the cleansing of my whole body by fasting, and my organs started working properly. All the toxins gone out of the organs, and I was able to conceive without going through NAET treatments. Right?
Wow.
But then when I started eating all the food back, my problems started coming back. And that's the reason I had to discover something to stop my reactions. Now, for the 38 years, probably around 38 years, I have finished all my treatments for the sensitivities and nothing has come back so far. Okay, that means this is good for 37 years, 38 years, that's for sure. But when I become 1,000-year-old, then I can tell you this is good for 1,000 years. Okay, or my prodigies, my other doctors, my students who will continuously treat for 1,000 years, then they can say, oh yes, this is discovered in 1983. Now 1,000 years later, this is fine. So this is long lasting. Okay, so now I only have the knowledge of 38 years of long lasting of this allergy elimination techniques. That's the reason I say, for me, it is a cure, even though we are not allowed to say cure in the medical world. Okay, but for me, my allergies are gone. I can eat anything I want to. I can go anywhere I want to and use anything I want to. So that is a cure for me. So if we can get everybody do this kind of cleansing and doing the treatment, they all will have good health in all areas of their lives.
Correct. I think when you deal with this chronic pain or chronic illness, not only fertility, make people as healthy as possible. And as you point out, we eat every day, and we our clinic try to optimize their diet. Let's say like a fertility diet, Mediterranean diet, or you mentioned you drink like a warm water, like in 8 cups a day. Same thing, kind of a same passion. And I think we trying to nourish people, but actually problem was not that they're lacking. Something is a reaction with whatever this food they are consuming by not knowing it. Is probably the one of the reason I think people facing in 2022. Is there any because I know there's so many food out there, and you have like I'm actually already in your NAET program, like a basic 15. Is there any common allergy, like a allergen or food group you identify during this infertility challenge specific?
People are different, and people have different allergies and sensitivities. So it's not like a one fit all kind of treatments or testing. So that's why I have this book, Say Goodbye to Illness. That one I have described how to do your self-testing at home in your privacy of your own home. So anybody can get that book and look at, I have given the illustration, the pictures and everything. So they can learn that, and they can test their allergies, their sensitivities in their own home, and find out, make a list of what they have problem with. Maybe it's a food, maybe it's a clothes, maybe it's any computers they are using, or cell phone, whatever they have, whatever is causing the infertility problem. So they can make a list of that and find a doctor very close to you, or come to you if they are near you, and then you can verify if they are on the right track, if they found the right solution, right problem, right cause for their problem. Then you can treat them, or whoever they go to, the NAET practitioners can treat them and eliminate their interaction, adverse interaction with those items. If it is food, drink, vitamins, supplements, herbs, whatever, they need to check them and make sure they are not sensitive to them. Once when they remove that, then their work is done. They will accomplish whatever they want to accomplish. If they want to have a baby, that's what's going to happen naturally. Okay. If they cannot do that for some reason, if they want to do IVF, you know, a lot of people are going for IVF nowadays, and frozen embryo or natural embryo, whatever it is. So that also, you need to check them, their energies. Is it compatible with your body? If it is not, you need to treat them. Once when you treat it, then your body will be ready to accept that also. So there are so many solutions if you can find the cause. So cause is in your own hand, you can find it. And you can, once when you find out, track down your causes, compare it with the traditional testing procedures. Laboratory testing and the scans, probably not enough to pick up all these sensitivities, because some of these sensitivities are not IgE mediated. IG-mediated allergies are like very obvious. You have eczema, you have asthma, and they have all these problems. And when you test the blood for the specific allergens, the food allergens, you will get the good reading. Then you will know, okay, I'm allergic to eggs, I'm allergic to nuts, I'm allergic to milk. You can see them in the list. But some of the sensitivities, there is no way you can really screen through the blood work. IgGs may pick up some, but still muscle testing and our NAET testing will pick up even the energetic imbalances in the body. So NAET is an energy medicine, right? So it will pick up all those energetic imbalances. So it's really patients should take charge of their own lives and to test and find out. Then if they find out that they have a list of allergens they cannot use, but they have some of them, they are okay, then they can stick with those, some of them, they are okay. And avoid the items that you are, you are not okay with it. If you cannot go to any doctor, if you don't have a doctor near you, so they can easily get your work done just by avoiding the positive items. So that also I have described in the book, so they can read the book. The book is available from all practicing NAET practitioners' offices, and also they can get it from NAET bookstores at www.naet.com and also in the Amazon.com. So usually all our NAET practitioners have these books in their offices to give it to the patients straight away, so they don't have to go through purchasing from the other places. So everything we are giving them, the access to all these kind of things. So that's why they need to take charge of their own health issues and find out what it is and find a solution.
Amazing. In our clinic, we specialize in helping patients with the natural fertility, but also IVF support. And then when patient having some problem, as you said, like a frozen embryo transfer, and it's very frustrating because I think it's kind of a not sensitivity, but it's a reaction. Like it's not only food, because you said it's environment, or it can be people or computer. So I think if they can prep it in proper way, I'm sure their success rate for the transfer will be very high.
Absolutely, yeah. They have to be prepared to get the IVF. Actually, IVF, FET, etc., should not just plan 1 week before. You should plan at least 6 to 9 months before. Schedule that far away. Then you check all these sensitivities to everything, whatever you have, maybe uterus, maybe uterine lining, maybe ovaries, or maybe fallopian tubes, whatever. Treat all those allergies and make it compatible with your body energy before it. So if you schedule about 6 months or to 9 months time, that will be good enough to remove all these essential sensitivities and then go for the IVF. Then you will be successful and you don't have to have so much disappointments and depression if it failed, right?
Absolutely, absolutely. So when we have a patient coming, like when a new patient coming, like I try to prepare for their upcoming transfer or IVF with egg retrieval, I'm noticing like more than, let's say like 30% of our patients, they have eczema, allergies, asthma. You see his body is in like some like a very irritated, especially mucous membrane, and they are probably excellent candidate for NAET.
Right. Yeah. That's the clue that they have allergies or sensitivities.
Absolutely. I think that especially when you really get pregnant, it's a little too late to get even treatment. So preparing before, and then your pregnancy will be very easy and then more like successful. I think absolutely great point, Doc. And so you mentioned like you had this like a success, like a fertility patient in your own clinic when you had it, you said?
Yes, in my clinic alone, we had over 1,000 children born through NAET treatments, okay? And only I had one failure. I don't know if I want to share that. I had one failure in my office. I always tell my doctors, should I share that? It's a funny
Sure,
joke.
if you don't mind.
Okay. One of my one of my patients came a year before and said she wants to do the fertility, work for fertility. So she had a lot of allergies. We treated her. Usually our patients used to get pregnant within 3 to 6 months. It's all done. Okay. And this lady took 1 year, still not did not have a child, did not have a pregnancy. So I said, okay, now it's time. Let's have an interview. So I called her to my office and we started talking because I thought maybe she needs some help in how things to be done properly and things like that. So when I talked to her, I found out she does not have a husband. Okay. She had met someone when she started with me, and she thought she's going to marry that guy or he will propose to her or something. But after a few days, it did not work out. Afterwards, she did not find another person to get married or to have any affairs or anything. So NAET cannot help in that kind of situation. So that was my failure. Okay. But then I told her, you can just get some sperm from the sperm bank. She didn't want to do that. She didn't know, she didn't want to get anything from any strangers or something like that. Then she had ended up adopting 2 children later. So
That's still a lovely way to be the parents. Actually, in our clinic, we have a lot of patients going through at this time donor egg. And then that I think is very important because it's probably have some a little more reaction than your own embryo or eggs. So I think that patient will be great candidate. So thank you so much for this wonderful story. And I learned first time and about your stories, and then very entertaining and then exciting because I can really see putting all information together, why this is developed and then why is effective, and then your own struggling, and then you made it as I said, just wonderful gift for all of us, including the patients. I truly appreciate it. Is it can you share you mentioned your website, but how people can find your provider? I mean how find yourself?
Okay, I do not work anymore. I'm retired. Okay, but I have 20,000 doctors I trained globally. Most of them are in America. Okay, we have people in Canada, Europe, Australia, and China, Japan, Singapore, all of these places, including Iraq. We have people doing NAET. So you can find their names going into our website, www.naet.com, and look for practitioners. And they will ask you to put your miles or something, how far away you want to go to the doctor. So you can put your distance from the doctors you want to go, 5 miles, 10 miles. So you may find somebody. In most states, we have a lot of practitioners, but some places probably not directly very close to them, but you can still find them. So that's the way you can find them. And go to them and have a talk with them and see if they can do the infertility treatments. And they do have to attend our special class for infertility, so that way they learn all this. We have several classes on different topics. NAET does not do only infertility. We do all kind of health disorders based on allergy sensitivities. So they can go there and ask them, talk to them, and then you can find the right person for you.
Amazing. Because I know your organization also focus on a lot of autism at this time.
Yes.
So being a parent and then become parent, but after that, how you can help your child in future as well. Such a valuable information. As I said,
we are actually going through an autism study, global study right now. We, still because of the pandemic, we could not do last 2 years because we didn't want the children to go travel and things like that. But we are still open. As soon as all the pandemic stops, we will be doing very serious enrollment again. And we will have extended for another couple more years so that more children can get in. And autism can be 100% treated through NAET if they have allergies. And most of them have allergies. So if they have a brain damage or something, that's a different story, But if they are sensitive to anything, and most children are, and we do the blood work and everything to verify it, and that's why we treat, and we have wonderful results with that.
So finding out if you're a good candidate for this wonderful technique available for worldwide, and then if you committed, and I'm sure we all get benefits. And I truly appreciate all your knowledge and time, Doc. And then this is, as I said, just my honor, because you create something wasn't there. Now you made it all available for everybody. That's just a gift for us. Thank you so much, Doc.
Okay, and one more thing before I go. When you have infertility and when you have sensitivities, your family members also have it. You inherited from your parents, and your husband also may have it. So just you treating alone may not be enough. You need to do your husband also. A male infertility or can contribute to female infertility. So you need to find out who has the problem. Both of you can have sensitivity. So you need to treat all those. And if they do, everybody gets treated for all this, not only infertility, they can also solve many of the other health problems. And instead of running back and forth to the hospitals and in and out, they can have better quality time at home if they are not sick or if they don't need so much treatments elsewhere. Okay.
Not only identifying what's the problem food, but also the relearn, and then you can start enjoying it is the huge part.
Right. And we have about 17 or 18 books written on different topics with the health disorders and NAET. So these are all available on our website. If anyone has a particular problem, they can look into that book and see what they can do. And a lot of these books I have also described self-balancing procedures. So they can get immediate relief of their immediate problems by balancing their own acupuncture points, which are given in those books. So then after that, they can go to the doctor and continue with the treatments. So they can reduce the emergency visits to the emergency rooms all the time. A lot of people have this midnight crisis, so they have to rush to the hospital. So there may be an allergy involved with it. So if they can learn to test their own allergies on their own, then they can reduce those kind of calamities. All right.
This recording of time, we are still in the pandemic. So if you can reduce your emergency room visit, why not?
Right. Okay. So enjoy talking to you guys. Enjoy talking to you all.